in the last 24 hours to 8 p.m, which is a great result. And I just want to thank everybody for that. Please make sure if you have the mildest of symptoms, you come forward and get tested. Or if you've been deemed to be a close or casual contact, you follow the health advice immediately. Last night to 8 p.m, New South Wales had 31 cases of community transmission. 13 of those cases were active in the community. And I do want to stress that this pretty much reflects the days just before and the day we went into lockdown. So what we're seeing today is pretty much a lag of the last couple of days before we went into lockdown. So we're anticipating that there could be an increase in numbers over the next few days. And then hopefully early next week, we should see the impacts of the lockdown really turning and having a positive impact. I do want to stress what we look at is how many cases we've had that were not in isolation either completely or partially. And last night's figure of 13 is concerning, and that is something that we are working to address by stressing to the community, stay at home means stay at home. Don't leave the house unless you absolutely have to. And please make sure that if you are a worker doing an essential job, that you do not turn up if you have the mildest of symptoms. This strain is so transmissible, so infectious, that even, as we know, a fleeting passing can have that impact. I also want to stress that if you're a close contact, it means you can't leave the house. That includes for vaccination, that includes for medical attention. If you are a close contact, please ring health and health will meet all of your needs. If you're a close contact and you need medical attention, ring health. If you need other supplies you can't get, please ring health. If you're a close contact, you should not be leaving the house. If you're deemed to be a casual contact, please follow the health advice. The health advice will depend on the venue you are at, the circumstances of your family and your household. So make sure that if you're a casual contact, you follow the health advice strictly to the letter. We know the settings in place are what is needed to take us out of the lockdown, but what we can't assume is that everybody will do the right thing 100% of the time, but we need to be able to assume that. So please, can I say to everybody, please follow the rules. The rules are there for a reason. The rules are there to make sure we get on top of these cases and that we can get out of lockdown when we want to. And please know that even a few people, a handful of people not doing the right thing can have very devastating consequences. So I ask everybody to follow the health advice. If you're a close contact, don't leave home. If you're a casual contact, follow the health advice. And if you have the mildest of symptoms, please get tested and isolated until you get the health advice as to what you should do next. So can I just ask everybody to please follow these rules, to thank everybody for what we've done to date. And I will say the next few days are critical because we know that what we're doing until this point in time is mopping up in the last few days leading into the lockdown. We anticipated that. I am relieved, I have to say, that the case numbers weren't as bad as what they could have been. Often in other states, in other jurisdictions around the world with this virus, you've seen a doubling or tripling of cases, which is what we were afraid of. That hasn't materialised. But we are still in a stage of mopping up. We're mopping up what the spread may have been either on the day of or the day before the lockdown, and that's what we need to keep an eye on. How many cases were circulating in the community and have we got all those chains of transmission that we otherwise may have missed. So I'm always optimistic about the future because I have faith and confidence in the people of our state. But the next few days are critical, and come early next week, we do want to see the tide turn in terms of the number of people with the virus who are in isolation as opposed to those who've been active in the community. And that's really what we need to look at in terms of decisions moving forward. So Dr. Chant will now give her health update. Deputy Commissioner Warboys will make a few brief statements around compliance, and then we'll of course take your questions.
New South Wales recorded 31 locally acquired cases of COVID in the 24 hours to 8 p.m. last night. 27 of these new cases are linked to previously confirmed cases, with 17 of these cases being household contacts. 4 cases reported to 8 p.m. last night remain under investigation, and 1 new case was acquired overseas. There have now been 73,602 tests were reported to 8 p.m. last night. Again, an amazing effort by the community of New South Wales, but also those testing services. We have We're treating and managing 172 cases. Most of those are being treated in non-acute out-of-hospital care, including return travellers in the special health accommodation, but we have 3 patients in intensive care. None of those are ventilated. Of the new cases today, 11 were in isolation through their infectious period. A further 3 cases were in isolation for part of their infectious period, and 12 cases were infectious in the community. We're just confirming the isolation status for 5 of the other cases. There were no new cases linked to Great Ocean Foods seafood wholesaler, but I do want to urge you to remain vigilant if you've been identified as a close contact. We do expect further cases to arise from that exposure. We've seen 1 new case today linked to the West Hoxton birthday party, and we've seen 2 new cases linked to the Crossways Hotel. So this brings the total number of cases linked to the Crossways Hotel to 12, including 8 people who acquired their infection at the hotel and 4 subsequent contacts. So the advice for people who attended the Crossways Hotel has been updated for a number of days. So all patrons and staff who were at the venue from the 23rd of June to the 27th of June is a close contact and must immediately get tested and isolate for 14 days, regardless of the result, unless they have already been contacted by New South Wales Health. We've also got 1 new case linked to the Joe Bailey Double Bay, and 3 new cases are linked to the Life Cafe in Bondi Beach. So the total number linked to the Life Cafe at Bondi Beach is now 28, 7 of whom acquired their infection at the cafe, and 21 of whom were subsequent contacts. We've also seen over recent days a number of cases linked to socially connected households in Western Sydney, and that relates to the workers that were, some of those were healthcare workers and aged care workers that we've discussed over recent days. The importance of those individuals coming forward to testing, or the initial case coming forward to testing, you can see that allowed us to identify rapidly 9 additional cases across 3 interconnected households, and then prevent those further chains of transmission. So please, anyone who has the most minimal of symptoms, please come forward and get tested. I just want to also highlight some venues of concern. At Bankstown Swimming Centre, Bluey's, 14A 949 Chapel Road, Bankstown. Saturday the 26th of June to Sunday the 27th of June, all day from 12 a.m. on Saturday the 26th of June and 12 a.m. from Sunday the 27th of June. We probably will be announcing some additional dates related to the Bankstown Swimming Centre as we investigate both upstream acquisition and infectious cases at that site. In relation to Bondi Junction, Coles Eastgate Bondi Junction, we had someone on Tuesday the 29th of June positive in that vicinity between 2 and 7 p.m, and again on Wednesday the 30th June from 5:30 to 6:30 p.m. Anyone who attended Bondi Junction, Coles Eastgate Bondi Junction, is a close contact if you've been to those venues, that venue. And then anyone who attended Coles Eastgate Bondi Junction from Saturday the 26th from 4:20 to 4:40 and Saturday 26th of June from 7 to 8 p.m. So this again highlights that because of the lockdown, the exposure sites are really shifting. We're seeing a move from hospitality venues, beauticians, hairdressers, to retail. So the message is, please don't go out and about shopping if in retail, in any setting, if you've got symptoms. Stay home, isolate and get a test. But also it highlights the importance, as people are moving around in shopping centres, please do assume that you're next to someone who may have COVID. Ensure you are wearing a mask at all times and ensure that it covers your nose and mouth. And also please keep your distance. We need to use all strategies to make sure we don't have any continuing transmission of COVID. Thank you.
Thank you, Dr. Chen. Premier, Minister, 75 infringement notices and 12 court attendance notices issued in the last 24 hours. A couple of those of note were for two people who decided they would leave Greater Sydney and travel along the north coast across to Lightning Ridge, Inverell, through Inverell, down to Dubbo, where they ended up at the Western Plains Zoo. They were spoken to there by police, issued with infringement notices and directed to return to Greater Sydney. Another incident, similarly, where a person left Sydney and travelled on transport, a bus, up towards the Brisbane area. That person eventually ended up back at Grafton, spoken to by New South Wales Police and issued an infringement notice and directed to return back to Greater Sydney. These two examples are just a couple of examples where people are still not adhering to the orders, that they're taking their own personal circumstances and desires beyond what's the best for the community. They are examples of where people will contact police, provide information where police can attend their location, issue them with the proper infringement notice and direct them back to Greater Sydney. I spoke yesterday about people trying to take holidays disguised as business trips. It is not on. People need to comply with the public health orders in terms of moving around New South Wales. It is very important. The other interesting infringement is a cafe down at Bowral, where the excuse for not wearing a mask was simply that they had no belief in the wearing of masks or the order, where they have no intention at all in complying with the order. It's not on. Police took suitable action. Police went to that location as a result of the community concern. It was a person in the community or a number of people in that community that had alerted police to that incident, and police went there and took action. The other point I would make is that right across New South Wales, we have seen police having to take action against people for breaching public health orders, whether that's in some of the most rural and remote parts of the state or in fact here in Greater Sydney. We will continue to do that whilst ever those public health orders are in existence. Thank you.
Does that mean you did charge those 70 odd people that headed to the zoo on the bus individually, or is that a new group of travellers?
I spoke about that this morning to the investigators. They are continuing collecting information and statements in relation to that, but I don't have an update on that in terms of the individuals on the bus. But again, we must remember that the company was breached, $5,000, and the people on that bus have all been spoken to at this point in time, and I can have some more information on that a little later.
Premier?
Sorry, Dr. Chan, have you updated the AHPPC that we might need to extend this lockdown?
No, we briefed the I'm not going to. Oh, sorry. Sorry. Firstly, I'm never going to comment on what discussions occur at AHPCC. That's been my policy throughout this, and I think it's important that we discuss that. I certainly have updated. I certainly provide frank advice about all of our cases and other things, but I'm not going to comment on anything around the AHPCC discussions. What I can say to the community is the best chance we have for coming out of the lockdown as quickly as possible is going to be if we see a turn in those numbers. And that relies on the community, one, to continue to come out and get tested. We have had a sustained testing level that we've never seen of before in the state. And I think the community response has been amazing, but we cannot get fatigued. We have to continue to track down any signs of infection in the community. And similarly, we have to go about our business as if everyone is infected. So business has a role to play, the community has a role to play. It is too early to assess the situation. I have not briefed the government on the situation because we knew that we were going to see cases for a period of time, and I think I flagged that earlier in the week. This is not unexpected. What we need to look at is increasing numbers of people isolated for the full period, the number of unlinked chains of transmission, the setting of those cases, and the context of those cases. All of these factors will influence our decision making.
Dr. Chan. It's been roughly half the new infections, roughly half of them have been in the community every day this week. Would you like to have seen that taper off by now? And is that what's informing your decision that we could potentially extend lockdown?
I'm not commenting at all about the future settings, what I can say is that the factors we consider closely is those infectious days in the community. But we will see, one day we see that that's explained largely because we uncovered transmission across that household contacts. And so, but the good news is that if we do uncover cases now, the exposures that people will have had in the community when they've been going around will be minimal. If you stay at home for the vast majority of the time, limit your grocery shopping to as brief as you can. Make sure that you're going at times that are not busy, maintaining that social distancing. Even if you haven't been isolating, you are not posing a threat to the rest of the community. And that is the basis for why the lockdown measures are effective. But they do rely on individuals taking those steps.
Dr. Chack, could I just ask you about some of the venues of concern? For example, Sydney Airport, we knew that an infectious passenger flew to Brisbane last Friday already. Overnight, you've listed Terminal 2 at Sydney Airport as a casual contact venue around the same time that passenger went through the airport. Has the horse bolted? Why are those settings been changed? Because it's a week on.
A lot of communication has gone on around the Sydney Airport. It has been listed at various times when new information's come to hand, but I can update you on the specifics of Sydney Airport. I think we've been very public that there's been a case transiting in terms of the flight crew, and our contact tracing has indicated that there was clearly transmission on that flight. From memory, we have highlighted Sydney Airport as a casual contact venue, or be vigilant for a while, but I'll just determine that issue.
Dr. Chen, when can people under 40 expect that Pfizer will become an option for them?
So we understand that the supplies of the vaccine, the Commonwealth is responsible for procuring the vaccine, and we understand the supplies of that will be progressively increased and towards the latter end of the year. But those are matters for the Commonwealth to advise us about vaccine supply. But certainly when there is no scarcity of supply, then I would expect that the distribution of Pfizer will increase and access points for the community will increase to Pfizer for everyone.
But Dr.
But in the meantime, can I just reiterate my message yesterday? If you had your first dose of AstraZeneca, book in for your second dose. Against the Delta strain, having 2 doses really is very protective against having hospitalisation and severe outcomes. So that's the best thing we can say to the community at the moment.
Dr. Trump, we know that there are a number of links circulating around the community that is giving people who aren't really at the right point of getting the vaccine being able to book appointments. How is this still happening, and how is it allowing people to jump the queue?
So at the moment, we have scarcity of supply of the vaccines. Now, we know that that will improve over time, and we are working, the state is committing incredible amounts of resources. I think the announcements yesterday highlight the commitment of the state to complement and work hand in hand with our GPs around increasing access to Pfizer. And again, I would like to message AstraZeneca. If you've had your first dose of AstraZeneca, please if you're elderly, go and get your first dose of AstraZeneca so that you can be at least afforded some protection.
But these links are allowing people in their 20s and 30s to sign up and go get a Pfizer in the next few weeks.
I'm not sure about that. If that's an emerging issue, we'll look at our data, but that hasn't been reported on the ground that there's been significant quantities of people outside our priority groups. I should say that there are priority groups that we do want to attract, and they're aged care workers and healthcare workers. As you know, the healthcare workforce is a large one, and there's often new entrants to that. It is critical that we maintain access to our workers in those settings.
Would you consider mandating vaccines? Premier, how concerned are you that people are clearly not following the close contact lockdown advice? And is it those sorts of people that could see our lockdown extended?
Can I say our success during the lockdown depends on 8 million of us. Each of us has a role to play, because every time we leave the house, we could have the virus unintentionally, not knowing that we do, or we could come into contact with somebody that does. I think all of us have equal responsibility during this time to do the right thing. And that's why it's so important for all of us to keep working together. Please know that what we've seen to date is not unexpected. Everything we've seen to date is expected. But what we would like to see, especially during the early part of next week, is that the number of people who've been exposed or have exposed the virus in the community has reduced. And that's what we're looking at. So it doesn't matter if those in isolation, well, I shouldn't say, obviously it matters to them, but in terms of what we look at, if you're already in isolation and you develop the virus, that won't determine, that case number won't contribute towards us determining whether we come out of lockdown at a particular time. What we do look at is how many cases have been active in the community, and that's what we would like to see reduce, especially from early next week, because what we're seeing now is still the mopping up of the last few days before we went into lockdown. But what I will say is I'm really relieved that we didn't see a doubling or tripling. You know, in other states and other parts of the world, when you have this variant, you've seen what we call the R effective, or the number of people that are getting the virus multiply every day. We've not seen that, which is a positive. But what I would like to see, and what Dr. Chunt would like to see, is especially come early next week, a reduction in the number of people that have been exposed or have exposed the virus to others, especially outside the southeast Sydney zone, because we know that area already has a high concentration of cases. We don't want to see Western Sydney and southwestern Sydney develop further cases where people have been active in the community. So we're appealing to everybody. If you see something wrong, it's not a bad thing to report it, because compliance is so important during this time. If you see somebody not doing the right thing or a business not doing the right thing, you can anonymously contact Crime Stoppers and make sure that police get there and make sure we provide safety to everybody. So all of us have a role to play. All of us talk to people. All of us are in contact virtually, I hope, with many people. Let's just get the message out that all of us have to collectively do the right thing for us to get out of this lockdown as soon as we can.
Premier, yesterday the Victorian Premier said that once everyone had the opportunity to get vaccinated, that is when the lockdowns will stop. Can you offer that same assurance to the people of New South Wales?
Well, New South Wales has always had a policy, and I want to make this very clear, that lockdowns are always for us the last resort. If you look around Australia, unfortunately, not other states haven't had that policy. But for us, it's always a last resort. And this situation was a last resort for us, given...
But will it stop when everyone's had a chance to get a vaccine?
Well, the Prime Minister, if he hasn't already, is about to make some comments about what National Cabinet determined in terms of the way forward. I broadly support the way forward. I think the citizens of Australia need a plan, but we also need to provide timeframes and details around that plan. New South Wales has for some time been talking about the importance of vaccination. I think I've gone blue in the face by talking about the sense of urgency to get vaccinated. Getting vaccinated, making the vaccination available to people is the key to our freedom, absolutely. And New South Wales has been extremely vocal about that for many, many months. We will continue to be. But I am looking forward to us entering a new phase in how we deal with the pandemic and how we deal with living with COVID. But also making sure that all of our citizens have confidence that we won't burden them unless we absolutely have to, no matter where they are in Australia. I'm sorry?
Are you upset that international arrivals are being capped? You fought hard against that.
Firstly, can I say that my heart goes out to thousands of Australians who have to wait longer to come home. Secondly, and I express this view, I've expressed it publicly, but I've also expressed it to my colleagues, the premiers and chief ministers in other jurisdictions. Just because you reduce the number of people coming in doesn't mean outbreaks aren't going to happen. New South Wales, without complaint, has been welcoming home 3,000 Aussies every single week. We have more than 5,500 people in our quarantine system right now. And yes, we've had a few issues, but if you compare that to other states who've only had a few hundred coming in or far less numbers, bringing less people home doesn't mean you're not going to have outbreaks, doesn't mean you're going to not have mistakes. And I want to be very clear and open about that to our public. New South Wales has always been happy to carry our fair share. In fact, we've carried the vast majority of people coming home. So I am disappointed that every state hasn't done its fair share, but I appreciate and have to respect the decision of National Cabinet. But I just want to be very clear. I don't support the view that other premiers have that this means mistakes aren't going to happen or we're not going to have outbreaks. That's still going to occur. But it's how we deal with that. And I want to be very clear about that, because you can't guarantee that 100% of people will do the right thing 100% of the time. Nobody can. And so I am disappointed for those thousands of Australians that can't come home, but we will follow the National Cabinet decision. And I appreciate that some members of the community in New South Wales will be relieved at that, and I get that. But please don't assume this means that mistakes aren't going to happen. Please don't assume that outbreaks aren't going to happen just because the numbers have been reduced. New South Wales is always the first to put our hands up and say, we will do our fair share, we will do what's right by our nation. But if the nation has made a decision about reducing those numbers, we will also do that. But I just want to really stress, it doesn't mean mistakes aren't going to happen, either here or in any other part of Australia.
Premier, are you
Premier,
disappointed that
Premier,
Victoria has declared all of regional New South Wales an orange zone?
Look, I'm not surprised. You can't on the one hand say don't have lockdowns and then lock out people for no reason. And I think what today provides as an opportunity is for National Cabinet to move forward consistently. I think why Australia has been in the position we have, we've had a very good response to the pandemic to date, but we need to lift our game and we need to be consistent across the nation. You know, it was very unfair when New South Wales was bringing home citizens from other states at a rate no other state was even comparing to, and yet our citizens were being locked out of their states for no reason. And I think my comments are relevant now. Why would you lock out people from a state when there is no hotspot associated in that region, when there is no concern? And I hope today is a turning point. I hope today means, through the Prime Minister's announcement of what National Cabinet has determined as the way forward, is that all of us have a consistent approach to how we treat our citizens. And I would like to see that happen, because it will give confidence to our citizens, it will give confidence to business. And I think today is I hope today is a new page in moving forward. And let's look at the facts when we're making decisions. Let's look at the science when we're making decisions. Let's not burden our citizens unless we absolutely have to.
There are now nine healthcare or aged care workers who've contracted the virus. What do you know about how many of them have been vaccinated? And would you support mandatory vaccinations for healthcare workers?
Well, interestingly, we asked the National Cabinet, we asked the federal health authorities to present a paper to National Cabinet, which we are still working through, but National Cabinet decided at its last meeting that all aged care workers, which traditionally are a federal government responsibility, would be vaccinated or made mandatory by mid-September. So that was a decision of the last National Cabinet, but other categories haven't been addressed at this stage. We're waiting on advice, but obviously we should have a national approach to those issues so that there's consistency across the nation. And of course, those key workers should be vaccinated, but the challenges are there. We have in New South Wales vaccinated over 200,000 key New South Wales health workers. There are always new people coming into the system, and making it mandatory does also have its challenges. And that's why we respected the advice we got through the National Cabinet process about that mid-September date, and that's what all the states are working towards.
Sorry, it
was Clinton hasn't had a go.
Just to ensure we get this one in before we do wrap up, have you tried to talk Commissioner Fuller out of retiring? Do you think he will stay on beyond contract?
Can I say, Commissioner Fuller is an outstanding commissioner. We need him now more than ever, and I know that he will give the job 100% till the day he retires. And of course, I would have loved to have seen him continue, but understand and appreciate his decision.
Dr. Chan, are you able to clarify how many of those healthcare and aged care workers were vaccinated, or if any?
If there are any other hospitals affected?
Obviously, we've now got 9 health and aged care workers, so the impact that has on the health system and their vaccination status.
So I'm aware that some were vaccinated, and there were a number that weren't vaccinated. We can collate that information. That information will be in our EPI report that we put up on, I think, every Thursday, but I'll make sure that that data is clear.
Dr. Chan, is 76,000 a new record for testing?
It is a new record. I'm pretty sure that you can say that's a new record. Look, the numbers do jump around a bit, and what I want to express is my incredible gratitude for the community in responding for those testing. But what's really important is it's sustained. What we saw in the Avalon and community was that a really big spike, but what's really been pleasing, this has been sustained, and what's also pleasing is our regional community has also continued to come out for testing, and that's going to be important because obviously we want to make sure that we have that we do not see any seeding. And again, can I reiterate, the health orders are in for a reason. We do not want any non-essential travel outside of Sydney, Greater Metropolitan Sydney, and if anyone does, they are subject to the stay-at-home provisions when they're there. So they can go work and do essential work, but they cannot go to pubs, clubs, hospitality. They can basically go outdoor exercise and do some critical shopping. Thank you.
Premier, just one question. Premier, really sorry. Are any other hospitals or health venues affected by the healthcare workers?
At the moment, it's the ones we've identified yesterday, but we'll update you. Obviously, it's a priority to do so.
Can we just get one on Mr. Fuller?